Dr. Monte here. Glad to have you join me. I'm going to talk to you a little bit about the use of ice. Oftentimes we have injuries and people wondered, should I use heat, should I use ice? So usually if it's an acute injury or an injury that just happened, whether it's an ankle sprain or a strained muscle from working out too hard or weekend warrior injuries, you want to use ice the first 48 to 72 hours. Don't even apply heat for the first 3 days because you've got swelling that's going to happen, and that's the body's natural reaction for healing, and it needs to come, but it also needs to go out. So I always use ice in the first 3 days, and then from there on, if you need to still use a modality of heat or ice, I prefer ice over heat if you can tolerate it because of several factors. The ice will vasoconstrict or shrink up the dilation of your vessels, so it'll help reduce some swelling. It'll also help reduce pain because it has an analgesic effect, which means painless or pain reducing. So it kind of basically numbs the area, all right? So it takes away the pain. Now there's a couple ways you can apply ice. One, you can grab an ice pack, okay? It's nice, hard, and solid, just like ice is, and put it on whatever structure is hurting. But the problem with that is it's kind of solid and it doesn't really mold around your contours of your body. So I'll tell you, if you stick around to the end of the video, how to make your own ice pack. They'll be very good at molding around your contours. So that's that. Now the other important thing, you never want to apply ice directly to your skin. You always want to have some kind of protective layer between the ice pack and the skin, whether it's a pair of clothing, a pillow sheet or a pillowcase over the ice pack is good. If you get a towel, sometimes the towel is a little too thick and you're not going to get the effects of the ice, but at least one layer maximum, and then like that. In addition of location of where to put the ice, you want to be careful of applying it to the outside of your knee right here. You don't want to compress it or wrap it around there very hard. If you do, you need extra padding right there because you have a nerve that's fairly exposed right under the skin that if you freeze that nerve, your outer 2 or so toes are going to be numb for quite a while. The other location that you want to not compress the ice onto or use extra padding is your funny bone. Okay, right here you have the ulnar nerve, and it's also fairly exposed, fairly superficial. If anybody's ever banged that, you know exactly what I'm talking about. And if you freeze that, then you're going to be nice and numb for, again, quite a while throughout these 2 fingers. I know that from experience. Listen. There's other ways to apply the ice, and that's using an ice cup. You can use doing an ice massage. If you get a Dixie cup or a styrofoam cup, to use solo cups, not as well because you can't tear off the top. But what you do with the cup, you fill it with water, you stick it in the freezer, let that become ice, and then you can tear off the top half of the cup. And now you have a little something that's going to insulate your fingers so you're not freezing your fingers at the same time to hold, and you've got ice that comes out the other part, and you can massage that part of your body that needs the ice, whether it's your shoulder, elbow, wrist. And you do that for about 5 minutes or until it's kind of pinkish red and or numb. If you can tap on the area and you're like, it's pretty numb, I can't feel it, okay, that's done. But 5 minutes is usually plenty of time to get the effects of the ice. That's for an ice massage. Now, how long do you want to use an ice pack for? You put that ice pack on. Typically, in the clinic, we only do it for 10 minutes, but those ice packs are really nice and cold. So at home with your ice packs, I would say no more than 15 to 20 minutes at a time. And how often can you use the ice? You can use the ice every hour if you need to for that 15 to no more than 20 minutes. So other ideas of how to get rid of swelling and inflammation, ice. So basically the idea is rest it, compress it, and elevate it, all right? So rice, rest, ice, compression, elevation. All right, you rice your injury. Elevate it above your heart level. Okay, if it's my ankle and I'm sitting on my recliner and I have my ankle elevated off the ground, okay, well that's better than having it down, but you really need to lay down, get that leg, get that ankle, get that body appendage above the heart. So there's your duration of how long do I apply it, frequency, how often can I apply it, and what position. So let me give you the ingredients for your best homemade ice pack you'll ever have. You get 2 gallon size Ziplocs, okay? In one Ziploc, you put 2 parts water to 1 part rubbing alcohol. Okay, so that's however much you want, say a cup of each, that's 3 cups. But say 2 cups water to 1 cup rubbing alcohol. And then you seal that up, and then you put the other Ziploc over the top of that, and that's just to ensure in case the first Ziploc leaks that you're not going to get all wet. You stick that in the freezer, all right? It's never going to freeze solid, okay, because of the rubbing alcohol. But the benefit of that, it's going to get extremely nice and cold, but it's going to be like a gel, so it can go around your contours of your knee, your ankle, your shoulder, just whatever you need to let that bend around, so it's not going to be so solid like ice and uncomfortable. You can bend it around. And then you just stick that back in the freezer and use it again. There you have it. Good for ice, good for you.